Now we have briefly covered most of the mechanical causes of hip osteoarthritis, what it can lead to hip osteoarthritis and degeneration. For example, we have covered trauma, femoroacetabular impingement, development dysplasia of hip, and the underlying disease of hip such as LCPD, SCAFE, and all that. But then there could be, instead of having altered biomechanics, we can have certain non-mechanical causes as well, which could be related to some blood problems, it could be related to the bone problems, or which could be due to the other toxic stimuli which may be interacting with the environmental issues as well. We will be dealing now, we're coming on to the avascular necrosis of the femoral head. Now, AVN of the head can lead to degeneration of the head, and then again the biomechanics would get disturbed. Problem could be due to underlying, most commonly there are multiple causes of the AVN. For example, the most commonly it's always associated with smoking and alcohol abuse. But other rare causes could be underlying diseases of the blood-borne diseases such as coagulation disorders, sickle cell, thalassemias, and then there may be associated problems with called as dysbaric osteonecrosis, then which there is actually associated with specifically with the deep sea divers as well. So when we are dealing with avascular necrosis of the head, we have to look at certain what is actually causing the problem. For example, this patient developed osteoarthritis later on, although the patient has a history of some form of a trauma. Despite fixation which was adequate at the time, eventually CRIF in form of a cannulated screws was done. But still, if you appreciate it over here, there is definitely increased sclerosis, deformed femoral head, as well as there is subchondral cyst and sclerosis is present, and this is actually leading to AVN of the head. Now this would require some form of replacement of the femoral head. Now, causes could be multiple causes, it could be idiopathic as well. For example, the patient absolutely may be fine but eventually developed AVN, and once the patient may present with having a hip pain, there are absolutely no mechanical cause, there are absolutely no non-mechanical cause, but it can be absolutely AVN due to idiopathic cause as well. Other is excess alcohol and smoking, as I told you, is more commonly associated with AVN of the femoral head. Then the patient may have associated rheumatoid arthritis or certain psoriatic arthritis as well, and patient may be on steroids, let's say for 5 or 10 years, 20 years as well, and excess steroids can lead to AVN of the femoral head. Then could be trauma as well, as we just saw it in the photograph before that in the previous slide, that there was some form of a CRIF with the cannulated screw was done because the patient had an age at which the head could be saved, but patient later on presented with development of the AVN of the femoral head leading to hip joint replacement. Then there could be associated sickle cell anemia as well. There could be associated Gaucher's disease. Now these are all coagulopathies which may be associated with it. Usually these patients are rare, but they can be a cause of the AVN of the femoral head as well. And other coagulation causes thrombophilia, which may be, for example, protein C and S deficiencies, then can also lead to this sort of AVN of the femoral head as well. Now how to diagnose it? Whenever we have to get detailed history. For example, in patient is coming with hip pain and groin pain and problems of this side, there will be definitely history of sickle cell disease or something is wrong. If you see it over here, this is a bilateral AVN, and previously you can appreciate on the left side there was some form of a grafting was done as well to save this head. There will be reduced joint space, increased sclerosis, subchondral cyst will be present as well, and this may also be a problem with the bone in general as well. As you can appreciate, this increased sclerosis is also present in the metaphyseal region as well as in the intramedullary cavity as well. And if you appreciate it over here, again there is reduced joint space, subchondral cyst and sclerosis is present. Now, if you are dealing with these kind of a patient, sometimes as there is no advanced stages straight away, because they usually present very early, sometimes the stage is such that we can conserve the head and prevent further degeneration of the head. eventually are further AVN. For example, if there is underlying cause of steroid, then we can stop the further insult. Or if the underlying cause is, for example, sickle cell anemia, then we can treat them by keeping them well hydrated. For example, if they're well hydrated and oxygenated, the problem would be that they will not develop sickle cell crisis and there will be no increased episodes of thrombosis in the femoral head. Other options, non-conservative, a non-surgical option include protected weight bearing, use of bisphosphonates, especially over the long term. Although they can produce atypical fractures, but they have been helpful in preventing AVN as well. And use of anticoagulation medicines, for example, if the problem is with the coagulation defect as well. Now, if they are coming to the surgical treatment, most of the time, if the AVN has occurred, usually requires surgery and can require surgery in form of a head replacement, that is in form of total hip replacement. Now, you must be wondering when we are going for surgery and when we are going for replacements, and why. When we are actually looking at the X-ray, then we have to look at whether the head is deformed or not. Sometimes there may be cyst may be present as well, there may be a sclerosis as well, or then sometimes there may be very subtle changes as well. Usually, for example, if you see an absolutely normal X-ray and you get the MRI of the same joint, you will see changes on the MRI. Now that means it's started and it's very early, and you can probably save the head from collapsing or completely going into avascular necrosis. So if the head is not collapsed, it's pre-collapse AVN, we can go for some form of a bone grafting. Bone grafting is actually one of the technique in which you go for you drill the holes in the neck so that you reduce the pressures, and this pressure, once is reduced intra-articular, this can actually save the head from further going into avascular necrosis. Or once you have drilled it, you can place the avascular fibular graft in form of a bone graft over there. Or you can also place vascularized fibular graft as well in the femoral neck. Therefore, all these potential agents, such as biological agents, can be in form of concentrated stem cells, bone morphogenic proteins, plasma-rich plasma, platelet-rich plasma. All these can be used in saving the head from going into collapse. We can go for fibular and non-vascularized as well as vascularized fibular graft as well. But once the head has collapsed, how do we know the head has collapsed? Means the head has become deformed. Once the head has become deformed, this is the stage where probably you cannot save this head. Now you will have to go for some form of replacement. And replacement is always in form of either, if the patient presents too early, for example at the age of 20s or 30s, then you can go for some form of femoral and acetabular osteotomies, or you will have to go for some form of a total hip replacement. If the patient has presented at an age, let's say at 40s or 50s, and now the patient head is deformed, you can straight away go for total hip replacement in this case. For example, if you see this is a post-collapse AVN, the total hip arthroplasty is probably the best option to replace the joint and can make the patient completely pain-free and mobile, and all the movements in the hip joint are possible. Usually with osteotomies, although patient does become pain-free and actually, but not all the movements are possible, and the patient will continue to still deteriorate and eventually will present maybe 5 years, 10 years later with further degeneration of hip joint leading to increased pain.